Hmm.
What are you doing with eggs? Don't you know they'll raise your cholesterol and make you die of heart disease or stroke?
Well, actually, it won't if you've read the latest research. I'm Dr. John Bartemus, and I'm putting the pieces together to help you live a life at optimal. Brand new research from the American Journal of Clinical Nutrition studied type 2 diabetics on high egg diets versus low egg diets and observed the change in cardiometabolic risk factors. You've seen the commercials, you've heard the TV shows, you've read the blogs. Cholesterol clogs your arteries and causes you to die of heart disease or stroke. Well, this research shows that that just isn't true. If it were true, then diabetics would definitely show cardiometabolic risk factor changes on a high egg diet, because diabetics are already at higher risk of heart disease and stroke just because of their disease process. So if eggs and the cholesterol in eggs, as the hypothesis goes, increases cardiometabolic risk, we would see it sooner in the type 2 diabetics. Is that what we see? This research says no. What they did was they took type 2 diabetic patients, and for 12 months they had the study group eat 12 eggs a week. That was the high egg diet. They'd eat 2 eggs a day every morning for breakfast. The low egg group ate less than 2 eggs per week, but they replaced the protein that the high egg group was getting from the eggs with other forms of protein like beef, chicken, etc. So both groups were eating the same amount of protein, just the high egg group got it from eggs, the low egg group got it from other sources. And they were also, during the 12 months, there was 3 months where the first 3 months they taught both groups how to maintain their weight. The second 3 months, both groups went through a weight loss phase, and then the last 6 months was a washout / follow-up period where they didn't necessarily practice weight loss, but they continued to eat the high egg or the low egg diet throughout the full 12 months. The study parameters or what they observed for change was blood markers for inflammation, for blood sugar regulation, for oxidative stress, and their lipid panel. They also measured body mass index multiple times, blood pressure, and quality of life. So at the end of 12 months, what did they find? At the end of 12 months, there was no significant difference in the weight loss between the two groups. Both groups lost the same amount of weight, high egg or low egg diet. There was no change in inflammatory markers, oxidative stress markers, blood sugar markers, or lipid panel. No change in cholesterol, HDL, LDL, etc. No significant difference. So both groups were the same, whether the high egg diet or the low egg diet. And as far as body mass index goes, no significant difference between the groups there as well. So between the high egg diet and the low egg diet, there was no significant difference in any of the risk factors, meaning the eggs did not increase cardiometabolic risk in either the high egg type 2 diabetic group or the low egg type 2 diabetic group. So that pushes that cholesterol in eggs causes heart disease or stroke hypothesis out the window. One very interesting change that they did observe, though, was the high egg diet's effect on homocysteine. Homocysteine is a blood marker that is a known independent risk factor for cardiometabolic risk or for heart disease and stroke. It's a known risk factor for dementia. It's a known risk factor for pregnancy complications if it's high during pregnancy. What they found was in the high egg group, homocysteine was lower over time. In the low egg group, that did not occur. So the high egg group lowered homocysteine. How does that happen? Because eggs are a source of betaine, and betaine helps recycle homocysteine in the methylation cycle. And so the high egg group eating high eggs week after week for 12 months got the dietary effect of lowering their homocysteine from the eggs. So you could say the eggs were even protective against cardiovascular disease in that sense. Did not see that in the low egg group. So this study basically proves or is another nail in the coffin towards the cholesterol heart disease hypothesis. It's actually a myth. Eggs do not increase your risk of heart disease or stroke. So I hope you're high-fiving people out there because you get eggs back for breakfast. That adds a whole bunch of diversity to your breakfast. You can also have them back for lunch and dinner and use them to cook, etc. Now remember, this study is relevant to the cardiovascular risk. If you have food sensitivities or food allergies to eggs, that does not mean you should eat them, okay? So this is relative to cardiovascular risk and the myth that cholesterol causes heart disease. That myth is busted. Go forth and eat your eggs.